Thammasat University, serving for the 2 international graduate programs at the faculty. It's my great honor and privilege to introduce Professor Dr. Kathryn Braun, Professor of Public Health and Social Work from the University of Hawaii, US. She is here with us. Professor Braun has been engaged in research related to aging for decades. She is currently the president of the Active Aging Consortium Asia Pacific, in short, ACAP. We are excited to listen to her sharing with us this morning about the roles played and initiatives adopted by ACAP during the COVID-19 pandemic. Professor Braun, you will have 20 minutes for your presentation and the 10 minutes for Q&A session. So all the participants here are encouraged to raise your questions or concerns and share your thoughts in the chat box of this Zoom meeting. We are going to collect the questions and select some and then bring to Professor Braun for your response. Professor Braun, now the floor is yours, please. Thank you.
Aloha. This is Kathryn Braun from the University of Hawaii, and I'm very happy to be with you today. I'm going to share a PowerPoint with you and talk about the roles of and the initiatives from ACAP during COVID times. So first of all, I would like to say greetings from ACAP. This is the Active Aging Consortium Asia Pacific. Our mission is to share friendship and best practices for active aging. You can see pictures of us from some past conferences together. We're a very happy group. We like to learn from each other. We have a free bulletin which comes out every other month with lots of news from you, from people from all over Asia Pacific. And to join our organization is absolutely free. I invite you to join, and I will show you how in the next slide. So we have members from all over the world, from Mongolia to New Zealand in Asia Pacific, and Canada, Europe, South America, and Africa on the other side, but mostly we focus on Asia Pacific with members from many of the countries, including Thailand, that you see on this map. So here's the way to join. Just send me an email and I'll add you to our mailing list. Oh no. So COVID-19 has changed our world, and I'm sorry, my husband just came to tell me you couldn't see my slides. I'm sorry. So sorry, here's the ACAP slide, and here is where all of our members are. So now the meat of the presentation. So COVID-19 has really changed our world. We have masks and physical distancing, lockdowns, economic disruption, and of course the impact on older adults is illness and death, higher rates of loneliness and isolation, and increasing needs for assistance. And we're especially concerned about social isolation, which is very bad for health. It increases depression and anxiety and reduces connections, social support, physical activity and functioning, cognitive functioning, access to food, and access to care. So what is the response from ACAP? ACAP, first of all, is an information sharing organization. So we have a free bulletin that we send to all of our members every other month. And in March of last year, we had a special issue on COVID-19 that describe the situation of COVID in many different countries, including Thailand, Hong Kong, Myanmar, Indonesia, and other countries on this list. And subsequent issues had stories about responses to COVID of ACAP members and ACAP countries. We also sponsored a webinar series last year. We had 6 webinars, and we're about to start our next webinars next month. But in the last year, we had 6 webinars with 21 speakers from 14 different countries. And our goal was not to talk as much about the COVID situation, but to really talk about innovative ways that we're trying to keep elders active during COVID times. So what kinds of things are we sharing in our bulletin and our webinars? We're sharing innovative educational approaches. We're sharing actions taken by universities, government, senior clubs, and to distribute masks and food. We're sharing technology ideas, actions in residential care, vaccination efforts, and more. So some of the interesting things that we've found and shared are culturally appropriate educational approaches. And from Indonesia, we saw this wonderful graffiti on COVID-19, and also some very nice flyers that, or pictograms we call them, for COVID in Indonesian language for do's and don'ts for COVID. From Japan, we found this very nice sign about Amabi. According to Japanese folklore, the god Amabi emerges from the sea and instructs people to defend against illness. So this became a symbol for stopping COVID-19. Also, education about social distancing, physical distancing. Instead of saying 2 meters, we say 1 tatami mat. Of course, there were many different clever ways to social distance, and to tell about that, here's one from the US, keep 1 cow apart. And here's one from Australia, at least 1 adult kangaroo apart. In Hawaii, we have educational videos, each 30 seconds in multiple languages. I don't have time to show them to you today, but if you go to this website, you can find educational videos about staying home, washing your hands, keeping your distance, isolation, and so forth in Chuukese, Marshallese, Ilocano, Tagalog, Cantonese, Mandarin, Japanese, and Korean. These are the languages most spoken by immigrants in Hawaii. And in Ireland, elders were asked to cocoon. A cocoon is what happens, it's what a caterpillar makes to help the change from caterpillar to butterfly. And so in Ireland, people were saying, please cocoon, stay at home, interact only with family members, and use technology to stay in touch. We also learned about many actions by universities, government, and clubs. And from Thailand, our ACAP representative, Professor Kathryn, wrote a story about Thammasat University's response. For example, Thammasat modified a dormitory to establish a field hospital for COVID-19 patients with mild symptoms. They also developed and distributed masks and alcohol gel. They moved their classes online, and they supported their students with free book delivery, a SIM card, and insurance. From Indonesia, the Universitas Raspati, Indonesia, also had an effort for COVID-19, where they raised funds, provided education, distributed masks and multivitamins, and brought groceries for seniors isolated in the community. And from South Korea, the Yangsan Elderly Welfare Center also cooked and distributed food so that seniors could stay at home and stay safe. Senior clubs in Hawaii moved their classes online, so you could still take your class in ukulele or take your class in hula, but now it's online. They also continued their volunteer services. So many of the older adults stayed home and made masks. We shared patterns. Those that had sewing machines were able to use those. Those that sewed by hand, they made and distributed masks for other seniors. And you can see one of our culturally appropriate health education signs in Hawaii for wearing your mask. From Hawaii, we also had a coalition that was comprised of 40 public and private offices, food providers, funders, the University of Hawaii, government, and they were formed to address the immediate and urgent food needs for Honolulu elders. And in 8 months, they have provided 1.2 million meals and served 8,000 elders per week in Hawaii. These are older adults who have been impacted by COVID, cannot get their own food, or find themselves without money to get food. And here's an example on a community level where with intergenerational assistance, the community group got food to elders. Here's a picture of the volunteers stacking boxes of food in the community center, all wearing their masks. And then here in a circle, the volunteers are blessing the food before its distribution to homes with older adults. Now, digital literacy has become more important than ever in the COVID pandemic. And we've learned from Australia that their senior computer clubs, and they have quite a few senior computer clubs across Australia, they kept meeting, they continued their face-to-face training, but they made adjustments. Now, Australia has very few COVID cases and has done a very good job of containing COVID, tracking, tracing, and keeping their population safe. So the computer clubs still meet, but they have strict rules about the number of people. They all wear masks and they have to keep the windows open. So you can see them in the club still wearing their coats because it can be chilly there. From India, we've also seen people increasing digital literacy among older adults. The Age Well Foundation in India has long been a leader in computer training classes online and using in-person training techniques, as you can see in the picture below. But now they've moved all of those trainings online and are helping older adults master both Zoom and cell phones and other computer applications so that they can make conference calls, book doctor's appointments, order medicines online, bank online, and shop online so that they can stay safe and stay connected in their homes. And of course, nursing home staff are helping elders too. Most residential homes in all countries have stopped visits from families and friends. And here is a picture from Hong Kong where the staff were trained to help the elderly use FaceTime to connect with their families online. And I think this is happening in many countries where the staff are setting up the FaceTimes for older people so that they can continue to stay in touch with their families who can no longer visit. And of course, technology can help older people to monitor their health and exercise their brains. So in one of our webinars from Hong Kong, we learned about technology that not only helps people self-manage their health, and monitor their blood pressure and their heart rate and their sleep status and so forth, but also it includes anti-epidemic exercises to encourage cognitive functioning. And here, technology in residential care is becoming more popular so that you have robots. Now these robots can do a number of things. For example, the top of this robot is a screen for video conferencing so that the older person can stay in touch with family and friends and join in classes or telehealth or anything they need to by distance. And then this robot also is a vacuum cleaner. So it can vacuum while it goes, and it also measures the quality of the air, and it also takes the temperature and does other things, takes the temperature of the older adult so that the staff don't have to come close, and it will help alleviate some of the staff's work. So these kinds of robots can be very helpful and have multiple applications within them to complete tasks within residential care. Now, you know, computers are nice and robots are nice, but of course, we still need human contact. And in our webinars and in our bulletin, our ACAP bulletin, we learned some ways that this can be done very safely in residential care. For example, residents in Hawaii need to exercise. So the exercises were conducted in the hallways. You can see there's a bar along the side of the wall, and older people are safely distanced, maybe 3 or 4 meters apart. And then they are led in exercises so that they can keep up with their exercise, wearing their mask with good physical distancing right in the hallway of the long-term care facility, of the residential care. In Korea, there are volunteers, and this is in Busan, the Research Institute of Science for the Better Living of the Elderly. Volunteers lead residents in activities to stimulate their cognitive, emotional, and physical health. And these are done safely with volunteers and patients wearing masks and staying apart and washing hands and washing equipment in between patients. And finally, an example from Japan, where residents are, even though the staff are not supposed to touch the patients as much as they used to, in fact, they still try to touch the patients because otherwise people would be very lonely if they were stopped, if touch stopped altogether. Touch is very important. And so in Japan, they figured out ways through hand washing and wearing masks to continue to exchange touch. So now what we need to do is we need to distribute the vaccine. And here is a report from February, from about a month ago, about doses throughout the world. And you can see in this area is the doses that have been administered in the Asia Pacific region. So you're just starting now. North America is a little farther along, but still only 15% of people have been covered. Asia Pacific is just starting. But what's wonderful is that government leaders are getting the COVID vaccine. In the United States, there's some resistance to getting the vaccine among certain groups of people. And it's very nice to see your president getting vaccinated. Here's Joe Biden, but also the Malaysian Prime Minister, the Indonesian President, the Indian Prime Minister, the Singapore Prime Minister, the Mongolian Prime Minister, and leaders of medical centers in Japan, all rolling up their sleeves and getting vaccinated as role models. And many of these are elderly. I think the only one not elderly might be the man from Mongolia who's only 40, but nice to have role models here showing people that the vaccine is a good thing and that we need to get vaccinated. Vaccinating our population will be challenging. We need more activity, awareness, scale vaccination settings and personnel, and priority list for who gets vaccinated first. Of course, priority lists vary by countries, classes of people, elderly people, and those with health conditions are usually prioritized. Residents and personnel in long-term care facilities, health and social care workers, teachers, and essential public workers. So these, in many countries, are the groups being vaccinated first. And in Hawaii, in residential care, we heard an example from one of our nursing home administrators about how they held 5 vaccination clinics in their dining room, and 900 took the vaccine, which included 90% of residents and 70% of employees in just a few sessions. Other ways that we are doing it in Hawaii is drive-through testing for vaccination. You can see here, cars just drive, someone walks over and stabs you with the needle, and there you are vaccinated. And finally, I wanted to share with you from Indonesia, one of the really creative things that they did in Yogyakarta, which is they created an art activity where the elders were singing at home and taking video of themselves while they were singing. The music was mixed by staff, and there's now a music video on YouTube, and I'm running out of time, but if you have a chance, this is a really wonderful video that shows this activity of a senior club that engaged seniors in singing, and then the song was sent to others to cheer them up. It's just a very wonderful, wonderful video. So in conclusion, we need to learn from each other. We're all in this together, and ACAP members are sharing the best practices in active aging. We invite you to join us and to share your best practices, because we would like to promote them throughout the region, throughout the world. We have an ACAP bulletin, which is published every other month, and our next deadlines are May 15th and July 15th. We welcome a story from you and photos, and our next webinar series will be starting in April, and we'll have a webinar every month. Once you send me your email address, I'll put you on our mailing list, and then you can get notices of our webinars and get our ACAP bulletin. So thank you very much. Khop kun ka. I'm open for questions.
Okay, thank you, Professor Braun, for sharing this very interesting and informative presentation. And it's happy to know an initiative Asian Pacific. Now for questions. Is there any question from the audience? Yes.
Wonderful presentation. The real value of the work that's being done. That is the collection of best practices and being able. Is the collection of best practices and being able to share that information. And you're conducting some webinars, and you're putting out a newsletter. But are there other ways, maybe the audience has some suggestions in getting this information out? Because it's not just the responsibility of governments, but also civic organizations in the respective countries of the region. And it's a wonderful resource that you're putting together, but getting the information out is often the great.
Yeah. You know, a dream is to have an ACAP website, but for now, we are happy to provide our materials and any online. Right now, because we have no dues and no money, so we are all volunteers. So we're doing the best we can here. Open to ideas though, and creative people.
Yeah, it will be great. It's like collective effort. Yeah, not only the governments, but the community and the different stakeholders, they all get involved and also having the resources to cope with the challenge around the world.
Yeah.
Thank you, Dr. Andy. Any other questions? Probably the presentation is so clear. And we do enjoy like your illustration, and also that's really the best practices we see from the slides. If there are no further questions, may I invite Dr. Andrew Corbin to moderate the first panel discussion. Dr. Andy, please. Professor Braun.